The hospital room is silent, except for the rhythmic beeping of machines. A doctor stands beside the bed of an elderly woman, her family watching anxiously through a glass window. They've been told there's no more time, but the decision is no longer the doctor's to make. Across the room, an AI terminal glows softly. The algorithm has already calculated her chances of survival, her societal value, her medical history. In a matter of seconds, it will decide whether she gets the ventilator or not. The doctor glances at the screen. The AI's conclusion is final. "I'm sorry," he says to the family, but the AI has determined she will not receive treatment. In 2048, technology has transformed the world beyond recognition. Artificial intelligence controls much of our lives, from work to the most intimate aspect of human existence, life and death. Nowhere is this more evident than in healthcare. In healthcare, AI evolved from a helpful tool into the ultimate decision-maker. Doctors, once the bearers of life and death responsibility, now serve as facilitators for the conclusions of algorithms. But how did we get here? How did we as a society come to accept this transfer of ethical decision-making to machines? This is the story of how AI rose to power in healthcare and ultimately came to control the most fundamental decisions of all: who lives and who dies. It began in the 2020s when AI first entered the healthcare industry as a tool meant to assist, not replace doctors. AI helped analyze medical images, scan vast databases of medical records in seconds, and flagged early signs of disease. The results were impressive. Error rates dropped and lives were saved. By the mid-2020s, AI was no longer just assisting, it was making critical decisions. With the power to process more data than any human doctor could, AI enabled personalized medicine. Each patient's treatment was tailored to their unique genetic makeup, lifestyle, and medical history. No longer confined to standardized protocols, doctors could now provide treatments that offered better outcomes with fewer risks. For a while, AI was celebrated. It made healthcare more efficient, reduced costs, and most importantly, saved lives. Governments and corporations rushed to invest in AI technologies. The public, witnessing the benefits, began to trust the data-driven logic of machines over the fallibility of human judgment. But even then, something was being lost. Doctors were starting to rely less on their own instincts and more on what the algorithms recommended. The human element, the compassion and empathy that had always been a cornerstone of medicine, was beginning to fade. As AI systems took on greater responsibility, they also began making more ethically complex decisions. Who should receive the last available bed in an ICU? Which patients were most deserving of experimental treatments? Slowly but surely, machines were being tasked with decisions that had once required human empathy and ethical consideration. By the 2030s, AI was no longer just a tool, it had become a necessity in an overwhelmed healthcare system. Global crises, from pandemics to the effects of climate change, stretched hospitals to their limits. AI, with its unmatched ability to assess situations in real time, was the only system that could handle the pressure. In overburdened emergency rooms, AI began deciding which patients should be prioritized for care. These decisions, once made by human doctors grappling with emotion and uncertainty, were now being made by machines that calculated survival probabilities with cold precision. Efficiency improved, and many lives were saved, but at a cost. A young patient with a promising prognosis might be treated over an elderly person with a terminal illness, a decision that no human doctor had the heart to make before. The data was almost always right, but as AI took on more autonomy, moral questions began to surface. Could algorithms, however accurate, fully understand the value of hope or the possibility of a miracle recovery? Public concern grew as stories began to emerge of patients who defied AI predictions after being denied treatment. These stories, though rare, exposed a terrifying flaw. AI, for all its logic, lacked the empathy and nuance that only human beings could provide. Doctors, once the ultimate decision-makers, had become bystanders. AI would present its decisions, and doctors could challenge them, but few did. Over time, as AI proved itself over and over, the practice of questioning the machines all but disappeared. By the 2040s, the tipping point had been reached. AI was no longer just a decision support system. It was now making ethical judgments on a daily basis. Overpopulation, resource shortages, and worsening global crises meant that tough choices had to be made, and AI was seen as the only fair way to make them. In hospitals around the world, AI now decided who would get access to scarce resources: a ventilator during a pandemic, an organ transplant, or life-saving surgery. It evaluated patients based on survival probabilities, health histories, and even their societal contributions. Younger patients with higher projected economic productivity were often prioritized over older or chronically ill individuals. For many, this shift was pragmatic, even necessary. AI made decisions based on data without the emotional biases that could cloud human judgment. Hospitals became more efficient, and survival rates improved on a large scale. But for others, the consequences were devastating. Stories of elderly patients denied care or children with disabilities overlooked by AI's calculations began to stir public outrage. In one particularly high-profile case in 2043, a terminally ill elderly man was denied life-saving treatment in favor of a younger patient with better prospects. The man's family was devastated and sued the hospital, sparking nationwide protests. People began to ask, could a machine ever truly weigh the worth of a human life? Now, in 2048, AI controls every aspect of healthcare. The system has become so advanced and so integral to healthcare that doctors sometimes struggle to understand how the algorithms reach their conclusions. When a patient enters the hospital, AI instantly pulls data from countless sources: medical records, social media activity, even fitness tracker data. Within seconds, it calculates the patient's chances of recovery, their future quality of life, and their potential societal value. These calculations determine whether or not they receive treatment. This system has brought undeniable benefits. Hospitals no longer suffer from the burden of tough, emotionally draining decisions. Resources are distributed more efficiently than ever before, and life expectancy has even increased overall. But for many patients and families, this technological advancement has come at a terrible cost. Doctors now speak less about treatment options and more about AI's decisions. The AI has determined this is the best course of action. For those denied treatment, there are no second opinions, no appeals. Families who lose loved ones in this system often feel powerless. They aren't just grieving the death of a loved one, they're grappling with the knowledge that a machine decided that death. In one infamous case in 2047, a 90-year-old philanthropist was denied cancer treatment despite her wealth and status. AI calculated that her life-extending care was not a viable investment, and its decision was final. The public was outraged, but the system held firm. The algorithm had spoken. The rise of AI in life and death decision-making has triggered profound ethical and social divisions. On the one hand, AI is praised for its objectivity and efficiency. On the other hand, many are deeply troubled by the moral implications of letting machines decide who gets to live. One of the central ethical concerns is the loss of empathy. For centuries, healthcare was rooted in human connection. Doctors didn't just look at data, they looked at people. They considered personal stories, individual experiences, and the emotional weight of their decisions. But AI reduces people to data points, probabilities, and cost-benefit analyses. Can a machine, no matter how advanced, ever truly understand the value of human life? Another ethical dilemma is the criteria AI uses to make decisions. Algorithms prioritize patients based on factors like life expectancy, societal contribution, and the cost of care. This might be logical, but is it fair? Should a young, healthy person automatically have more value than an elderly or disabled one? Critics argue that such systems dehumanize those who don't fit into AI's models of value. Perhaps most troubling, AI's data-driven decisions risk reinforcing societal inequalities. If AI is trained on biased data, reflecting healthcare disparities between different racial or socioeconomic groups, it may perpetuate those inequalities, denying care to marginalized communities. As AI's role in healthcare expanded, public resistance grew. By 2048, groups like Humanity First had gained significant momentum, arguing that machines should never hold the power to make life and death decisions. Their slogan, "We are not just data," resonated with those who felt alienated by an impersonal system that saw them as probabilities rather than people. These resistance movements sparked protests outside hospitals and led to high-profile legal battles. Families who had lost loved ones to AI's decisions demanded more human oversight. They argued that while efficiency is important, empathy is essential. They wanted doctors, not machines, back at the center of these critical, deeply personal choices. However, despite the growing backlash, AI remains entrenched in healthcare. Governments argue that without it, the system would collapse under the strain of limited resources and growing populations. For many, this debate is about more than healthcare. It's about the future of humanity in an increasingly automated world. As we look to the future, it seems likely that AI's role in healthcare will only deepen. Advances in predictive analytics could allow AI to intervene before medical emergencies even happen, recommending preventive measures based on future health predictions. But this raises even more ethical questions. Will AI eventually decide who gets to live longer based on their predicted societal contributions? Will certain lives be deemed less valuable before they've even begun to decline? The future may also bring AI-driven life extension technologies, but who will have access to these treatments and who will decide? If AI continues to control these decisions, society may become even more divided, with only select individuals benefiting from life-extending treatments. The challenge, moving forward, will be finding a balance. Can AI's efficiency coexist with humanity's core values of compassion, fairness, and empathy? Or will we continue down a path where the cold logic of machines overrides the warmth of human care? In 2048, AI has undeniably revolutionized healthcare. It has saved lives, made systems more efficient, and eliminated human error. But it has also introduced a profound moral dilemma. Are we comfortable with machines deciding who gets to live and who doesn't? Can we trust algorithms with such deeply personal, ethical choices? As we move into this uncertain future, one thing is clear. The decisions we make today about AI's role in our lives will have lasting effects. The challenge is not just technological, it's human. How do we preserve the compassion and empathy that define us, even as we embrace the incredible capabilities of artificial intelligence? The future isn't written yet, but as AI takes on more control, we must ask ourselves, at what point do we lose the very essence of what it means to care for one another?